334 positive cases of COVID today in Victoria. There is sadly, of course, one death, and we extend our condolences and thoughts to the family of the deceased. It's a man in his 70s from Coburg. 127 Victorians in hospital at the moment with COVID, of whom 33 are in intensive care and 21 are on ventilators. We've also, of course, with close to 43,000 test results yesterday, we've now delivered over 10 million COVID tests in Victoria since the very start of this pandemic, well over 1.5 million of those in the last few weeks as we deal with this current Delta outbreak. I'd just like to thank all those 10 million Victorians, all those people who've come forward and got tested over the long 18 to 20 months that we've been working in this pandemic, and of course the fabulous staff in our testing stations, in our pathology labs, who are working literally around the clock to make sure that all those tests are processed and returned back. 99%, over 99% of all those test results are coming back the next day, giving anybody who's got symptoms the confidence that they'll get a quick answer as to whether they have COVID or not, and whether they present any risk to the people they live with and the people that they may work with. I would urge anybody who is feeling symptoms at any point in time, please make use of that testing facility. We are continuing to expand our testing centres. We've extended the operating hours again of 3 of our busiest sites in the northern and western suburbs to 12 hours, to 8 p.m. at night, to make sure that we can continue to meet the demand for testing that we're seeing out there. I'd also like to point people again to the very large showground site that we have. If people are concerned at all about waiting times at our sites, and some of our sites again yesterday were busy, then please look at options around. We have a real-time update on our website that will tell you where your nearest sites are, and also how long the queues are likely to be. And for those of you in the inner north or inner west, the showground site is a very good option as one that has always good capacity and short waiting times. In this time, of course, there are not many reasons to leave your house, but getting a COVID test is one of them, and you can travel more than 5 kilometres to get your COVID test, of course, within the metropolitan area. And if you're in regional Victoria, please, of course, stay within the regional Vic areas. Finally, with regard to testing, we're now seeing up to 8,000 people a day applying for the test isolation payment. So for anybody who is concerned about losing work, anybody who needs to miss a shift, anybody who's concerned about not getting paid for the time they're going to miss while they're waiting for that 24-hour turnaround on a COVID test, you are eligible for a $450 test isolation payment. 8,000 people a day are now applying and getting that payment. It is easy to do. Details are on our website and will be sent to you if you're getting a test. Please, I'd encourage you to make use of it. It is far more important that we enable you to miss a day's work and to still get paid to ensure that you get tested and that you isolate, so we can contain the positive cases that are out there in our community. With regard to vaccination, another record day of vaccinations in our state clinics. Over 39,000 people came forward yesterday to get their vaccination done. And again, my thanks to everybody who is now making it their priority to get vaccinated. 64% of Victorians have now had their first dose vaccination. That's a really encouraging step. We are ahead of our projection of our first 1 million dose surge that we announced a few weeks ago, but also we're starting to really get ahead of that date to get to 70% of Victorians having had their first dose. A bit more work to go, but we think we will be well ahead of that original date of the 23rd of September. We think we'll smash that by quite a few days. I'm also pleased to see that 71,000 people made vaccination bookings yesterday. And so again, please, if you haven't yet booked your first dose, please do so. There are multiple appointments available of both vaccine types across our clinics. There is Pfizer still available. There are AstraZeneca doses still available. We are releasing more doses just about every day. Any opportunities we find for doses that are spare and that are not being utilised, we put them back into the system. So please keep checking. If you haven't got your appointment yet, please check and make that appointment over the days ahead. Right now, we've got 10,000 first dose AstraZeneca appointments available in just the 7 days. And I know our teams are loading more Pfizer appointments into the system yesterday and again today. So please do check to see if you can get your vaccine sorted out in the next few days. Finally, with regard to vaccination, we've seen really strong uptake of our VCE students coming forward to get vaccinated. At least 56,000 of 16, 17 and 18-year-olds have already had their first dose vaccination. That's a really encouraging sign, and we'd encourage anybody in that 16, 17, 18-year-old age group, if you've got a VCE date due, and if you're due to take the GAT on the 5th of October, please come forward to get your first dose done. There is a priority booking service available for you. We are still holding first doses for those remaining students who have not yet had their first dose appointment. We'd encourage you please to get it done in the next few days so that you can head into your GAT and VCE preparation with confidence. With regard to the outbreak, so 334 new cases in the last 24 hours, and a very familiar now pattern of spread of where those cases are falling. 190 of those cases are in our northern suburbs, including suburbs like Craigieburn and Roxburgh Park. We've also seen 109 cases dropping in our western suburbs, in places such as Truganina and Altona North. We have 9 cases in the eastern suburbs, 16 cases in our southeast suburbs, including Noble Park and Frankston. And I am a little bit concerned about the number of cases we're starting to see creeping into the southeast. So we have a dedicated focus with our southeast public health team. I please encourage anybody, particularly in the Dandenong area in the southeast, please check those exposure site maps on a regular basis, and please be very aware of your symptoms. We're obviously dealing with significant community transmission in the north and west of our city. Huge number of people dedicated around the clock to doing everything we can to run that transmission to ground and to stop it in its tracks. But we are seeing a little bit of seeding out into the south and east, and we're very keen to ensure the community down there is also aware of the risk of COVID in our community. Finally, we have 4 cases in regional LGAs. One of those is the V-Line staff member that the Minister briefly spoke to, who resides in Gippsland, but again, got tested very early. We have a good understanding of their movements, and rapid contact tracing is taking place. My thanks to the entire team at V-Line for supporting us over the coming days as we work to make sure that their workforce has not been exposed. We also have a construction worker in Mitchellshire who works in a wider Metro Melbourne construction site. Again, we understand they're isolating safely. And we have a call centre worker in Kinglake, again a call centre worker who works in the CBD and is part of one of our call centre outbreaks. There was one more case we believe is in Bacchus Marsh. We're just running that one to ground at the moment. We'll release more details this afternoon in the Cho release if they are to be reported. In terms of key sites of interest and key exposure areas, I mentioned yesterday the aged care facilities in Moonee Ponds and at Gladstone Park. I'm pleased to confirm we've had no further positive cases arising out of those facilities, and very good testing levels and very good vaccination levels. And again, it highlights the importance of vaccination in stopping the spread of COVID in these most vulnerable and important facilities, and I'm very pleased to see such high vaccination levels amongst both their staff and their residents. We also have continued to see significant case numbers at KSR Suites, that's KSR Suites in Coolaroo. We've spoken about the site a number of times in the last week. We now have 57 cases associated with this community store, obviously a significant cluster of concern. And my thanks to both the owners of those stores, of the store, and the associated community for their support in the wider testing program we've been working on with them over the last few days. We also have a significant number of cases at Alhaji Meats in Glenroy. Again, we see now 43 cases, an increase of 9 on yesterday. Again, a significant community transmission, and one we spoke to the other day around community retail stores, local community stores being quite a significant cluster in some cases of positive cases. Again, we urge all people, whichever stores you're using, whichever parts of the community you're in, please make sure you're using the QR code check-in, because we are seeing transmission hubs at these locations. And please make sure, of course, you do all the social distancing and mask wearing that we need to do at this quite challenging time. Finally, at the Acquire call centre, we've seen an increase of 10 cases, all in household primary close contact of cases we've known about. That takes us to 78 for that outbreak at this point in time. Similarly, the Box Hill construction site now has 115 associated cases with it. It's now one of our largest sites that we're working on. Again, a significantly mobile workforce. We are now at day 10 of that outbreak. Day 13 testing, we think, will identify possibly a few more cases. And finally, another CBD construction site with one new case, taking us to 9 cases, again across multiple levels of a significant office fit-out. Still working on a number of other cases or a number of other leads in that investigation. Finally, of course, today is a positive step forward for regional Victorians as we see an easing of restriction at midnight last night. I would encourage, please, all regional Victorians, please be aware of the continued threat of COVID in all of our communities at this time. As we're seeing in today's cases, we're fortunately seeing not many cases, 4 cases of people residing in regional Victoria, but with clear links back into Metro Melbourne. Again, any authorised workers, if you're living in regional Victoria but continuing to work in Metro Melbourne as an authorised worker, please be very mindful of all those COVID-safe practices and make sure you get tested immediately if you have any symptoms. I'd also please urge all Melburnians at this time, stay where you are, stay within your 5K radius, stay within Metro Melbourne. This is not a time to be going into regional Victoria. With the level of community transmission we're now seeing, particularly in the north and west of our city, it is our job as Melburnians to stand our ground here and to fight this fight here and to get it down as quickly as we can and to look to better days ahead.